Hi guys,
Hello.
how are you doing? So I'm here again. I'm back for our next vlog. So this is a very interesting vlog because we'll be talking about this very famous Chef Hazel. Ang ganda ng case nito ni Chef Hazel and I want to share it with you guys. Chef Hazel went to our clinic with the chief complaint of having this yellowish teeth. So she's not happy with the color of her teeth. And of course, with that celebrity status as a chef right now, medyo kailangan ng a little bit more of enhancement, you know. She's medyo conscious about the look of her teeth. So it's not just yellowish, but also whenever she talks, hindi masyadong kita. It appears that there's no teeth masyado sa upper.
So for today's video na, gagawa tayo dito ng Bang Bang Shrimp Toast. Bukod yung video nito. Hindi, pero kaya ako gustong ibukod to dahil nga, dalawa, ano ba yan?
So because of the length of her teeth and as well as the totality of the lips, may mga contributory factor kasi when it comes to the shape and the size of the teeth in relation to the face. So medyo naliliitan siya yung ngipin niya. That's why she wants to have it done and enhanced a little bit. But because of a little bit of anxiety when it comes to having veneers, ginawa ni Chef, nagpa-teeth whitening muna siya. So we did a teeth whitening and actually lightened the teeth a little bit from the a little bit yellowish to whiter shade. And na-achieve naman yung mas maputing ngipin.
Ang baka kang tignan. Okay ba? Sorry. Uy, maliwalas.
Maliwalas. Tignan mo na. Alin dito yung mas parang... Let's see what's right. E2 for you. So, kanina, ito siya. Sige, sige nga sa mirror.
Oh my God.
E3.5.
Hala, oo nga.
Hindi mo siya papansin kung hindi natin itatapat yung shade ng kanina. Diba? Kala mo parang wala masyado.
Oo. Babalitaan ko kayo pagka na kaya kong whitening lang. Tapos, hindi ko na satisfied. Yes.
Okay, let's see you again.
Ayan. Halika na. Thank you po. Bye.
But then again, mas iba pa rin yung nananaig sa kanya, which is yung the shape, the size, and also the length of the teeth in relation to the face. So gusto niya pag nagsasalita siya, nakikita din yung ngipin. And dahil sa kanyang work ngayon, which is more on talking in front of the camera, and she wants to improve that a little bit more. Not just the color, pero yun, totality talaga.
Several months later.
So before we jump into the treatment, of course, clinical assessment is very important. Radiographic assessment and dentofacial analysis is very important. So whether case requires minimal intervention, dapat yung atake doon is very into fine details, no? So control dapat yung bawas kasi we are going to add volume. We are going to add length, a little bit of thickness. So hindi dapat yung pasobra na standard talaga na bawas-bawas na mas malaki. Kasi we're dealing with like add more volume. So I need that sound structure, especially the enamel, in my favor. Kasi once you use the enamel properly, I mean treat treatment, proper treatment, mas maganda yung bondability niya. So after getting all the details, I did not design it sa laboratory. I actually did a direct composite mock-up or design directly on the patient's teeth. So hindi siya hula-hula. Medyo mas finorm ko siya doon sa bibig mismo. Tapos chinek ko yung height, yung length, and yung bawas. So it was a direct composite veneer as my smile design, and also I was able to control kung saan ko siya dadalhin yung case, if ano yung mas bagay sa kanya na length, even the color, and even with the preparation, alam ko kung saan ako mag-stop.
Ang ganda nung after. Makita na yung, parang na ano yung, ano tawag doon? Na-emphasize yung ipig ko sa harapan.
So the preparation was very minimal, and it is actually more advantageous for me and for the patient because of the bondability of the material to the enamel. So it doesn't mean that if you do a non-prep or less prep, it will affect the bondability or the strength of the porcelain to the tooth structure. So hindi naman siya ganon. Because we have also to assess the occlusion, if there's parafunctional contacts, if the patient has problem with the TMJ or the muscles that holds the mouth. So we have to thoroughly assess.
Several days later.
So why lithium disilicate material rather than zirconium oxide layered with porcelain? Because with their case, it's minimally invasive, wala ako masyadong babawasan. Lithium disilicate is really known to adhere with the tooth structure, and it's natural looking. It's more translucent as compared with the zirconia. Although we have like a zirconia material that is translucent, but if you would ask me, because of the density of the material, it is always better to choose lithium disilicate for a very, very minimally invasive procedure, and if you want to have like a translucent effect na matibay. That's why I chose lithium disilicate. So we do have a lot of types, plethora of porcelain available in the market. But here in my practice at Apostol, I only use either lithium disilicate or zirconium oxide layered with porcelain. We always layer it with porcelain to create that lifelike effect. Sometimes I use zirconia, especially if the patient grinds a lot and if there's a parafunctional contacts that tends to create more trouble to the ceramics that it might possibly break. So if I choose the material, dun ako sa more durable for some cases that it really requires durability. So this is the final result. As you can see, it's very natural looking. We placed in a little bit lighter shade, no, para na mas babagay sa kanya. We lengthened the teeth, especially on the front two central incisors, and then it follows the curvature of the lower lip. So habang pa-canine to premolars, nagpa-follow siya. So you have like this smile line effect. It's not like monolithic. As you can see, there's serrations in there. There's like perikymata. There's a lot of characterization. But for some, may hindi masyadong kita, pero it's a little bit of more intricacies when it comes to combination to appear that kind of result. Especially if you will see her in person, it looks really natural, beautiful, and bagay. It's apostolified. But then, because of ganda nga ng upper. And she's very, very confident about the way she smiles right now. She's more confident. Of course, having a veneers is a responsibility as always. And it should be flossable. That's why we clean everything. And then Chef Hazel naman did a great job by flossing, brushing, to maintain the health of the teeth.
Pero ikaw, nagpa-flash ka naman.
Nagpo-floss.
In order for you to keep your teeth for a very long period of time, I mean, keep that beauty and the health, the longevity of the porcelain veneer, you have to really take care of it. For our mouth to be able to adapt to the new sets of teeth, especially we added volume, we added thickness, we added length.
Sobrang
mahirap pagsalita.
wala. Nung una lang siguro, Dok, mga 1 week, 2 weeks, ganyan. Nanibago yung ano. Sumisingaw yung S, ganyan.
Kasi pinahaba ng konti, no?
Oo. Pero ngayon, sanay na ako. Tapos ang matindi rin, lagi nagpipicture na ako ng tears, Dok.
It requires 6 weeks for us to adapt and adjust with the new sets. Hindi siya automatic, like pagkakabit, pack, perfect agad.
Nope.
Hindi siya ganon. There will be problems with your speech. There will be a little bit trouble with how you talk, with your smile, with everything. Because our mouth actually surrounded by nerves and the muscles and everything. You can be able to feel everything, especially if there's some changes. So when you change the volume, when you change the height, of course, the mouth will always have that feeling of a weirdness. So we have to really be patient, and after, usually for the human being, sabi ko nga, 6 weeks period for us to adjust and adapt. Once na nalagpasan mo na yung time na yon, minimum of 6 weeks, you'll be fine. I mean, it will go back to the original speech, the regular feelings. Pero if the patient will adjust and adapt to a wrong bite, it's gonna be trouble. That's why for us, when we do this, we have to make sure that we should consider all the factors. We should consider the occlusion, the bite. We should consider the lips. We should consider the color, everything, because we want the patient to adapt to a beautiful sets naman and healthy and functional. So that's the conclusion of our vlog today, and I hope you liked it, and I hope you can relate with Chef Hazel's case. And I believe that a lot of people wanting to have veneers, but they don't have the courage of getting one. So please don't jump into conclusion that you need veneers kaagad. So proper assessment muna is very important. That's the key. That's the #1 step. And then if you want to have a more minimally invasive procedure or non-invasive procedure, I would like you to have an assessment, perhaps a whitening. So like Chef Hazel, she's anxious to have her teeth done. But dahan-dahan, dapat you have to find that value in you na gusto niya talaga. Kasi it's really hard to get veneers pero hindi kayo sold out, because you will always ask yourself, why did you have that kind of veneers? So there are plethora of material available to get that beautiful smile. It's not just porcelain, it's just not zirconia, but a lot of materials available, such as composites, such as feldspathic and everything. but you always trust your dentist if saan sila magaling. Kasi at the end of the day, this is a team effort of the dentist, the technicians, the assistants, the staff, and everything. So go find a reputable one and have your case assessed, and then discuss it with your aesthetic dentist, and yun, before you decide. Thank you, and I hope I will see you again in our next vlog. Okay?